My name's James Ho. I was born and raised in Singapore. Spent the past 27 years in the US. So I still practice over there, but I'm happy to have the opportunity to come back to Singapore to practice as well since about 3 years ago. So here I am trying to bring some of the skills and knowledge that I learned overseas back to serve my fellow countrymen. I've been treating Invisalign patients since 2004 in the US, so that would make me almost 10-year veteran in using this technology. And at the beginning, I was very conservative. I treat the cases that are most predictable because there's been always rumors out there that says Invisalign is weaker than the traditional bases and this and that. But over the years, I've come to learn that Invisalign is a very powerful technology. In fact, there are cases where I don't feel comfortable treating with regular braces that I use Invisalign to treat, especially cases that involves where I need to make a skip where the cover of the Invisalign can allow the skip to happen. So as you might have imagined, I would treat all the cases from class 2, 3, and the normal crowning cases, extraction without extraction cases. So basically, I try not to say no to patients when they ask for Invisalign. And then the challenge becomes how to get around the issue using the best the technology has to offer. Well, in Singapore, I must say that I was pleasantly surprised that there are many patients who come to me because of the Invisalign brand name recognition that they would seek dental treatment for the first time in years. Normally, I would expect people who have been under regular dental care upon suggestions of the dentist, they would say, okay, let's do something about the crooked teeth and stuff. But the surprise element was when they just came to me and say that they want treatment because Invisalign is, they have friends or family, or they heard about Invisalign, and that's been, it's because of the various advantages it offers. So they come to me, and from that point, I was able to help my patients by, bringing them awareness of regular oral hygiene and other dental needs that they may have. Because as you know, all Invisalign patients has to be qualified before we can just say, okay, let's take the impression. In fact, that's usually the last thing that we do after all the dental needs have been taken care of. But having said that, most patients are in Singapore are quite receptive to my recommendations, and I'm happy to be able to help them along their dental care and dental needs, in addition to giving them a beautiful smile. Like I said before, the patients in Singapore, some of them, they would come to me as the first point of contact after many years of absence from the dental office. But in the US, most of the patients who have been under my care, they would come to me because they would do Invisalign because I've brought to their awareness how Invisalign can help them. So this is the main difference. But having said that, I like to say that it is my ultimate goal to treat all patients the same way, to the same exact high standards I set for myself.